Great. Thank you very much, Ben, and thanks to IOSH for this opportunity to speak with you all today. Just other couple biographical notes. I worked for IOSH for 20 years. I was a field compliance officer for 18 of those years, doing inspections in manufacturing, retail, agricultural settings. And then the last 2.5 years, I was working as the special assistant to the chief of the division in headquarters in Oakland. During the same period, I was, and still am, the volunteer coordinator of the Maquiladora Health and Safety Support Network, which is an all-volunteer network of about 300 occupational health professionals in the U.S. that have donated their time and expertise to improve working conditions in the developing world. We've been doing projects in Mexico, Central America, Indonesia, China, and most recently in Bangladesh, all with the idea of increasing the OHS knowledge and capacity of local organizations, worker organizations, be they unions, worker centers, women's groups, human rights groups, and the like, dealing with global supply chains in such industries such as electronics, the garment industry, and sports shoes factories. What I'm planning on talking about today is to take a look at the occupational health and safety and CSR, that being corporate social responsibility, risks in global supply chains, take a look at why the dominant CSR strategy has really failed to improve actual factory conditions in the supply chains, and take a look at what's needed for the effective programs on a factory level in the pathway to get there. You'll have to excuse my American rendering of the mother tongue, but hopefully it'll be comprehensible to you. Let's see here. Oops. I'm sorry. Right. So supply chains that we've had experience with for the last 20 years, as most people know, if anybody's had to deal with them, have a series of problems which existed then and exist now, unfortunately, in almost any industry that you want to speak about. Global supply chain factories are characterized by very long hours of work, almost all of them in violation of national laws and also in violation of the many corporate codes of conduct that have been developed over the last 20 years. Pay rates are very low. The pay itself is often delayed or underpaid or never paid at all, in a phenomenon that's known as wage theft. There are unsafe and unhealthy conditions, which we'll talk a little bit about today. There's also fairly rampant physical abuse and sexual harassment in many supply chains, which are populated primarily by young women from rural areas that have come into big cities to get jobs. Child labor is still a problem in many of these supply chains, and the supply chains in almost all the industries are characterized by a lack of basic legal and human rights. Now, the questions you may ask is, well, how do we know this? And there are basically 4 sources of information on conditions in supply chains today. One are the news media reports, which I'm sure everyone's familiar with on television and the newspapers. In the United States, for example, every Christmas we have a series of reports of children basically making toys for other children in China, where 80% of the world's toys come from. The second source of information is called our factory reports from non-governmental organizations. Oftentimes these are labor rights organizations, human rights organizations, or women's organizations that have relationships with the workforce in the supply chain and publish reports on the conditions there. There are going to be 3 separate documents sent out to each of you following this webinar, one of which is a selected resources list. And many of the non-governmental organizations and the other sources I'll talk about in a second are listed there as to where you can find more information about any given particular industry or particular companies for that matter. The third source of information on supply chains is what's called multi-stakeholder initiatives. And these are initiatives by corporations, by government agencies, by non-government agencies. And probably the ones that people may be familiar with here in the UK is the Ethical Trading Initiative. There's also a similar organization called the Fair Labor Association in the United States. And then fourthly, the transnational corporations themselves publish every year, 2 years, these glossy CSR reports, annual reports, which if you read them closely actually have a lot of information in them about so-called non-compliance with corporate codes of conduct, which means that the supply chain which they themselves are running are full of factories that have problems in safety and health, have problems in wages and hour, and in treatment of the workers. So in these four areas, we're able to, I think, ascertain a fairly detailed look at global supply chains. And as I mentioned, that information will be on the selected resource list at the end of the webinar. So then the question is, why has there been so little progress? I mean, the corporate social responsibility movement started out as a cottage industry in the early 1990s, and it's now an $18 billion a year industry with its own set of organizations, conferences, books, webinars, and all kinds of activities. And I think there's three reasons why CSR has basically failed to make more than marginal improvements in global supply chains. The first is that what I call the sweatshop business model, and I'll talk about these more in detail in a second. The second fatal flaw, as it were, is ineffective and corrupted monitoring. And the third is the lack of any meaningful worker participation in developing, implementing, or maintaining factory-level health and safety programs. In terms of the sweatshop business model, what we've seen in the United States, and I'm sure it's true of British multinationals as well, is an internal conflict between the CSR and the sourcing departments, where the CSR department has a set of goals and principles or priorities which simply are ignored by the sourcing and purchasing departments of the transnationals which are running the global supply chains. And so you have a near complete lack of integration between CSR goals, and it's dominated by the so-called iron triangle of sourcing. That is the lowest possible price, the highest possible quality, and the fastest possible delivery time. And this iron triangle actually trumps all other considerations internally and externally in most corporations. And you have what we call in the United States a global race to the bottom, in that you have multinational corporations basically roam the world looking for the most vulnerable worker populations and the most compliant governments, and then offer the lowest possible price. And it's not only the initial price that's low, but any renewal of contracts usually mean a 2% or a 3% reduction from the year before, so that supplier factories are actually squeezed by international brands over the course of their contract, so that the amount of money they have available for obeying national laws or even implementing corporate codes of conduct is limited and reduced every year, year by year. In addition, some of the procurement policies of the transnationals are not helpful in terms of having effective health and safety programs. Oftentimes you have unfunded, that is, they're not paid for, last-minute design changes or order changes that supplier factories that have to finance and undertake themselves. The practice of short-term contracts means that the supplier factories are never sure whether, if they finish this order for a transnational, whether they'll have additional work in the future. And if you are the manager of one of these factories, you're not going to institute expensive safety programs like installing ventilation systems or doing health and safety training or developing guards on machines if you're not at all sure that 6 months down the road you're going to have work. And recently, over the last 10 years or so, many brands have required that their supply chains undertake a variety of CSR programs, such as computer programs or English classes for the workforce, but very few of the brands actually pay for those programs. So you have, again, the same situation where suppliers are asked to do unfunded mandates, as it were, and have less resources available to do what they need to in order to obey laws and to meet codes of conduct. I think a good way of summarizing this is this graphic that came from Maclean's magazine, which is out of Canada. It's sort of the Time magazine, or it's a very mainstream magazine in Canada. And after the Rana Plaza in Bangladesh in 2013, they ran this image which displays for a $14 shirt how the cost breakdown. And you can see on the upper right-hand side that the labor costs for a $14 shirt are really only 12 cents out of the entire cost. On the left-hand side, the factory margin or the profit is only 58 cents. And so that the entire cost to produce a shirt is less than $6 an hour, as you can see on the bottom, or about 40% of the retail cost. The other 60% of the retail cost goes directly to the retailers or to the brands, or if the brand is its own retailer, it goes straight to the brand altogether. So you can see that the international brands have a lot of resources to play with if they wanted to, and the factory supplier managers actually are relatively restricted to what they have available. The second problem with the CSR programs and global supply chains is really ineffective monitoring. And this is principally because you have such unqualified auditors. In the CSR auditing firms in the United States, almost all of them are financial accountants, and they literally have no training or experience in occupational health and safety. And yet these are the auditors that are making the determinations whether supplier factories are in or out of compliance with basic health and safety programs and laws. Many of these inspections are done, most of them announced in advance, so the factories prepare for the monitoring visit. The visit itself oftentimes is a tick-the-box operation where people walk around with checklists and just tick boxes to meet their quotas. There's been a real growth of the CSR monitoring industry over the last 20 years. So you have big companies like Bureau Veritas or Intertech or SGS, which are now public companies. They're publicly traded, and they have their own profit targets as well. And ironically, for an industry that was set up to deal with the problems created by subcontracting and supply chains, many of these CSR outfits are actually subcontracting their own work. They're subcontracting actual inspections and certifications to other companies, and then passing along the inspection and certification work of other third parties. And lastly, for these monitoring companies, there's almost an inevitably inescapable conflict of interest. And consultants know that their future work depends on what their present work produces by way of a client reaction. So if you have a consulting company, or a monitor rather, that gives relentlessly negative reports about the conditions in the supply chain of an international company, which is its client, it's very unlikely that that monitoring company is going to have future work from that client. So there's a self-censorship or a censorship function that comes in. And almost all the monitoring to date, frankly, has been very ineffective and corrupted in a real sense. And the last issue, which is concern in terms of undermining or a fatal flaw of the CSR programs, is a near zero participation by workers. And I think all of us in the occupational health and safety profession take it as a matter of course that the effective health and safety programs anywhere in the world, be it in the UK or the US or in the developing world, cannot be effective if they don't have meaningful and genuine participation by workers. The CSR programs have a lot of verbiage about worker empowerment, but that almost never occurs in global supply chains. And so the key roles that workers can play in health and safety programs, which all of us know, such as things like conducting inspections and identifying hazards or investigating accidents that have occurred, evaluating and verifying whether the abatement or remediation of hazards actually works and has been done, and even peer training with coworkers, almost none of that occurs in global supply chains. So then the question is, what can we as occupational health professionals do about what are obviously big picture problems? Many of the solutions to this are above our pay grades, or they're certainly above the pay grades of OHS professionals in the United States. But I think if we think about turning on its head the three fatal flaws of CSR, we can begin to make some progress. OHS professionals can advocate for a better business model, which I'll talk about in a second. We can't control the business model, of course, but we can advocate for it both within our companies and within the profession. Secondly, I think OHS professionals can help design accurate and more credible monitoring protocols. And thirdly, something that which is within our bailiwick is we can help design global OHS programs that include meaningful worker participation at all levels of the supply chain. So in terms of the better business model, one of the handouts that will be coming to you after the webinar is a little what I'm calling a cheat sheet, which has all these different elements to it. So you'll have a chance to look at it in black and white in front of you. But clearly, if we're going to overturn the sweatshop business model, which is really dominant in the global supply chains today, there's several elements that have to occur. There has to be a real integration between CSR policies and the sourcing policies of the company. There has to be better communication between departments within the buyers. So, for example, design departments cannot be encouraged or should be actively discouraged from doing last-minute changes, or having orders from the finance department be also a last-minute change, which means that supplier factories have to throw out all of the sort of compliant procedures they have in order to meet their clients' orders. Pricing policies have to actually cover all the actual costs and allow suppliers to meet their legal requirements. Now, again, this is not something that we as OHS professionals probably have much control over within our companies, but I think it's something as a health and safety measure, it's very important that professionals advocate for that the pricing policies do not lead to a race to the bottom, which is clearly what's happening today. Also, the better production planning will reduce the amount of unsafe and unhealthy conditions that are generated by last-minute changes or last-minute orders, which create tremendous mandatory overtime, which, as we all know, increases the hazards to workers, increases the exposure to things like noise or chemical contaminants if you're working 10, 12, 14 hours a day. Likewise, I think the corporations that are serious about having corporate codes of conduct that mean something, that are not just sitting on a shelf in corporate headquarters, but actually implemented on a factory floor in their supply chains, really need to have a better idea of where their supplier factories are coming from. And that's from the first tier all the way through the informal sector. Transparency is a buzzword that we've all heard today, but it's crucial in terms of disclosing the information which would help customers, and we're all customers as well as professionals, know what the conditions are. Also establishing long-term contracts so that supplier factories are encouraged to actually have health and safety programs and ventilation systems and training programs that will reduce hazards on the job would be very important. Also, there's a growing movement to have a traceability mechanism for consumer goods around the world. So essentially giving every factory in a supply chain an identification number that would allow consumers and health and safety professionals to know exactly where the products are being made, and then combined with public disclosure of the monitoring reports, we would be in a position to judge what exactly those conditions are. Again, effective, transparent monitoring cannot be done under the current system, and has to be, I think, truly changed so that the kind of inspections that are done by monitors are much more like the inspections that we do as occupational health professionals. And I think transparency is very important because almost all of the CSR department's reports that we receive from corporations these days are not providing the detail of what these conditions are, and it could be that they've been greatly improved over the last year or 2 years, but we, because of the secrecy involved in monitoring, never find that out. Also, there should be a way in which corporations, without getting in trouble with antitrust or legal considerations, should be able to share information between buyers about the nature of these factories and what the conditions are, and then also develop mechanisms by working with local organizations, be they human rights groups or community-based groups, to really verify what these conditions are in the plant and what's reported in the monitoring reports. Genuine worker participation is key, as I mentioned, in almost any effective program. Many countries around the world have requirements for factory health and safety committees, including worker members. But almost none of these in many of the countries, including China and the ones in Asia, where much of the supply chains are located really have functional committees that have worker participation in a meaningful way. It's very important if you have worker health and safety committees that they be provided with the training and information that they need in order to conduct the tasks that have been designated for them as part of the committee work. They also need to have the authority by management to actually act on unsafe conditions or to suggest improvements in the evaluation and correction of hazards. And they also need paid release time in order to perform these duties. And without that, a nominal health and safety committee that has worker participants in it that aren't able to function really does not help health and safety improvements there. Also, as part of improving supply chains, having an effective, incredible complaint program, a complaint mechanism is very important. That would mean hotlines that are in a way accessible and anonymous and that actually result in actual responses. Hotlines are a very trendy thing at the moment, but they're really no more than sort of electronic versions of the suggestion box. And I think all of us are familiar with how seriously the suggestion box is taken in most of our workplaces. So it'll be a challenge for occupational health professionals to develop hotlines or other mechanisms where the concerns and observations of workers can be heard by management, heard by the health and safety staff, and acted on in a real way. And really, what's the key rights for workers in the developed world, such as the UK or the US, that's the right to know the hazards to which workers are exposed, the right to act to correct or eliminate those hazards, and the right to refuse work need to be part of the rights of workers in the developed world, in the developing world rather, in global supply chains. I think one of the things that we need to do more of is to learn from the experience of others that have been sort of leaders in the CSR field over the last 20 years. One of these was a guy named Doug Kahn, who worked as the CSR director of Reebok before Reebok was merged into Adidas several years ago. And he told the Financial Times here in London 13 years ago now, something that's fairly obvious, I think, that we have inspections of factories, both announced and unannounced, but we just don't have the assurance that things will be the same the next day. Factories in China are incredibly sophisticated at finding ways to fool us. The best monitors are the workers themselves. And my pitch today is very much along those lines, that the best monitors, the best way to improve working conditions in global supply chains is to authorize workers to play a much bigger role in these supply chains than what's happening now, that they be empowered, that they be informed and knowledgeable, and that they be active as partners in health and safety programs in global supply chains. One of the things I was asked to do was provide some examples of good practices, and I know that we don't have enough time today to go through this, but the third piece, a third document that you'll receive after the email, one is the selected resources on conditions in the supply chains. The second is the cheat sheet on what's needed to improve supply chains. And the third is information on these good practices. But let me just explain these briefly. Kangtai Shoes is a sports shoe producer in the Pearl River Delta in Shenzhen, China. And it was a Reebok factory in the early 2000s, which Reebok encouraged, in fact, required their Chinese supplier to follow Chinese law, which was to have actual democratic elections for the union committee, executive committee in the factory. Everyone except the chairman of the factory committee was elected in a multi-candidate election. And it turns out that 4 of the people on the executive committee also were part of the Health and Safety Committee. And so that Health and Safety Committee was actually a very functional institution in that plant and did monthly inspections, gave tickets, fix-it tickets as it were, to line leaders and to department heads, and actually investigated accidents and did some peer training. And because of their activity, it was a marked improvement in the reduction of injuries and also in the reduction of turnover in some departments when long-standing concerns and hazards were addressed. So there's information about Kangtai shoes in the handout that you'll get. The second example is what's called Alta Gracia, which is a clothing brand that's been set up by Knights Apparel, which is a U.S. manufacturer in South Carolina. And they decided to try a different model than the dominant business plan in the garment industry. They set up a factory where they paid 3 times the prevailing wage for garment workers so as to recruit and retain the best garment workers they could find. They recognized the union at the facility, and they gave the union a meaningful, and workforce in general, a meaningful role in the Health and Safety Committee, which is actually required under the laws of the Dominican Republic, but very often is nothing more than a nominal exercise. So Alta Gracia is 4 years old, and it's an experiment in a genuinely no-sweat business plan which has health and safety as a priority. And Georgetown University in Washington, D.C. did an evaluation last year on the first 3 years of the plan and found that it was not only financially feasible to have this model, but also it resulted in much better working conditions. And that information for that Georgetown study is in the information that I'll send you. So that's basically the information I had shared today based on the work of our network in various parts of global supply chains. And I'd be happy to answer any questions that you may have. Webinars are always sort of a weird format because we can't talk to one another directly, but if there are questions that people want to type in, I would be happy to do my best to answer those. So there's a question here from Bob Harris, who wrote, I can understand what we can do as professionals by feeding information and recommendations up the supply chain. However, what are organizations such as the United Nations and World Health Organization are doing to canvass governments to limit working hours in their countries? There are, of course, as you know, the ILO, the International Labor Organization, is part of the United Nations, and they have conventions, and about 30 conventions related to workplace health and safety. And they also have a number of conventions related to working hours, to treatment and anti-discrimination in global supply chains. In around the world, rather. So the ILO conventions, of course, are only become the force of law in the countries where global supply chains are if those national governments have ratified the convention in question, be it OHS or wage and hour. Many of the countries where the supply chains are located now have not adopted or ratified or implemented these ILO conventions. And frankly, it's in part because the global multinational corporations that have these supply chains, are roaming the world looking for the most vulnerable countries. Bangladesh, for example, has the lowest wages of any of the garment-producing countries in Southeast Asia or South Asia. And so as a consequence, there's tremendous growth of production in the garment train in Bangladesh. Last year, $24 billion were exported in Bangladesh. At the same time, the Bangladesh government, as is known by anybody who's been there, is severely challenged with the lack of resources, both human and technical and financial. It's one of the probably most corrupt governments in the world. I think Transparency International rates it as one of the worst 5 in the world. And yet it is the sourcing for many of the major clothing corporations in Europe. So as a consequence, you have a government either by corruption or lack of resources, which is totally incapable or unwilling to enforce regulations to protect workers. It's unlikely that a UN or a WHO or ILO convention is going to change that. These are big picture problems. And unfortunately, the big picture problems are taken advantage of by many of the multinationals when they're looking for sourcing spots, rather than being a positive force for the development of strong national governments that actually are able to enforce their regulations or create new ones if they don't have any to speak of at this moment. One other aspect of that is I know that, for example, both Mexico and China have OHS regulations, which are roughly equivalent to those in the United States. I'm not as familiar with those here in the UK, but I would imagine the UK is probably as good or better than what exists in the United States today. But the problem in Mexico is even though the OHS regulations there are equivalent to those in the United States, there is near zero enforcement of those regulations along the U.S.-Mexico border, where there are about 3,000 so-called maquiladoras, or assembly plants, that produce billions of dollars that are shipped just across the border to the United States. Now, the reason for that is that Mexico is a very poor country that has a foreign debt of about $220 billion, and they have to pay about $22 billion in interest and principal, again, in dollars, every year. So a poor country like Mexico has to depend on foreign investment for the source of dollars that would be able to pay the principal and the interest of these loans. So anything that discourages foreign investment in Mexico, such as actual enforcement of health and safety regulations or the development of new ones, is really economic suicide and a political impossibility for the Mexican government. So in a weird sort of way, the issue of foreign debt in Mexico becomes a health and safety issue, because there will never be any national enforcement of health and safety regulations while the country is under this enormous debt and the responsibility for annual payments of billions of dollars. Now, the case of China is a little bit different because, of course, China's got lots of money. They have lots of dollars. But they also have a very large country where 24 million young people are coming out of high schools every year and looking for jobs in the economy. Now, there's only 22 million people that live in Australia. So if you're the government of China, you have to find a new job every year for every man, woman, and child in Australia, or the equivalent of that in China. So again, it's a question of foreign investment, so that anything that discourages foreign investment in China, such as implementation of the health and safety regulations or promulgation of new ones, is again a political impossibility and economic suicide. So a lot of the problems that we face in global supply chains are not really technical in nature. They're big picture problems that deal with politics, they deal with economics, and they deal with societies. And our role, I think, as occupational health professionals is to recognize that fact. At the same time, we're pushing as hard as we can for the best technically competent OHS programs around the world to realize that a lot of these problems will not be solved unless there are changes in the global business model that supply chains function in, changes in the monitoring and auditing system, and changes in involving meaningful and genuine participation by workers in global supply chains. Okay, and then there's a follow-up that says, so what do you feel could be done to stop the pressures put on suppliers to meet targets? For example, recent examples of the Olympics and the World Cup football committees seem to put contractors under pressure to complete on time within budget, leading to risks being taken and deaths happening. This is really where the rubber meets the road, and I think that the example of the Olympics is a pretty good example in the sense that here in the London Olympics, as I understand it, for all the construction that was done here in the UK to produce the buildings and the facilities, one construction worker died. And if you look at the situation in Qatar, which is slated to have the Olympics in 2022, as I recall, more than 400 construction workers have already died in the construction of what are to be Olympic facilities. And I think that's because there's a tremendous difference in the way that the London Olympic Committee and the Qatar government is handling the construction for these. As I understand it, here in London, the construction companies were required to have very effective health and safety programs, that there was bidding that included an effective enough money that there would be health and safety programs that people could actually make good on their promises. And I also believe that there was significant worker participation in health and safety programs here in London. So I think that the big picture problems are difficult to deal with. We can't snap our fingers and have a new business model in place for global supply chains. What we can do, I think, is advocate within our organizations, and particularly on the issue of transparency, which I know is a big campaign of IOSH with regard to supply chains, that they should become much more transparent in terms of where these products are being made, under what conditions they're being made, what hazards are being found, and what hazards are being corrected. I think that transparency would go a long way into improving and encouraging international brands not to have a race to the bottom or a sweatshop business model if they know that their customers and that the public at large is aware of them. That's step one. And step two, I think, as occupational health professionals, we can advocate within our organizations and design our programs so that there is, in fact, meaningful and genuine worker participation on all levels of the supply chains, the workers who best know what the hazards are in their workplace, who might have useful ideas as to how those hazards can be corrected, and can certainly verify and confirm whether whatever is suggested to correct the hazards is working and is in place. So Rebecca Russell asks, as a consumer, is there any way I can check the retailer's policy and track record in their supply chain to ensure that I'm buying ethically? That's also a very good question, and there's certainly a number of institutions that are out there that try and help that way. In the United States, for example, there's an app called Good Guide where you with your iPhone you scan the ticket of the item, particularly clothing or baby children's clothing and the like, and it has a database which will show you what published reports indicate the conditions are in the supply chain. Frankly, I think almost all the consumer products we're dealing with today come out of sweatshops of one variety or another. So I don't really think that unless you know that these are worker co-ops or that they're special conditions that are being made for cooperatives or other ways, I don't think there's any way to assure that in a regular mainstream supply chain that it's not a sweatshop. What I would do if you want to be an active ethical consumer would be to communicate with whoever your favorite brands are, all of which have very elaborate and glossy CSR programs and pledges and codes of conduct, would be to communicate with your favorite brands to say that you as a consumer, a loyal consumer, expect them to actually make good on all their promises, and that you expect them not to run operations which are basically a race to the bottom. Now, as to whether they'll take notice of that from one or two consumers, I can't say. But I think that that's one thing to do. The other thing to do, which I suggest to people in the United States, if they're concerned about their purchases, would be to figure out, okay, if I spent X amount of money during the course of the year in clothing, and figured that because of these global supply chains, it was 50 pounds that I had saved from these global supply chains, I would send that 50 pounds to one of the worker or women's or human rights organizations that are in supply chain companies that are actually working with supply chain workers. So, for example, in China or in Bangladesh, there are many women's organizations or worker centers that are playing sort of a watchdog role with global supply chains, trying to put pressure on global supply chains, and they, of course, are very poor and without resources. So if they had just even small amounts of money from consumers in the developing world to make this connection between the workers in the developing world and the consumers in the developed world, so that there's an alliance and whatever resources available to ensure the working conditions in supply chains, I think that would be a help as well. Well, if there are no more questions, thank you very much for your attention. Oh, wait a minute. We have from Duncan Carlisle, referring back to your case of Bangladesh and the lack of HSE, CSR within the garment industry, is the government actively seeking to improve their situation, taking into consideration the high corruption rates? Well, they are now, unfortunately, after the Rana Plaza, which I'm sure everybody's familiar with. They had two great disasters, one in December of 2012, the Tazreen fashion fire killed 112 workers, in a way that was reminiscent of many, many different fires that had taken place over the last 10 years in Bangladesh. And then 6 months later, you had Rana Plaza, where 1,100 people were killed in an instant in a building collapse. So after Rana Plaza, both the international brands and the Bangladesh government realized that they would not be able to sell any garment that said made in Bangladesh if they didn't do something with regard to this situation. So in Bangladesh today, there's actually quite a bit of activity. Unfortunately, it's not very well coordinated, and a lot of the wheels are being reinvented. But nonetheless, you have all of the international brands have a health and safety program. There's a thing called the Bangladesh Accord, which is 205 international brands, most of them here in Europe, but probably about 15 from the U.S. that have signed on to a legally binding agreement with 2 international unions in Switzerland and their local affiliates. And under the Bangladesh Accord, more than 1,600 factories have been inspected by genuinely independent, qualified inspectors, both international and Bangladeshi engineers. And all these things are now in the process of being corrected. And it's the first time in any supply chain in the world where you've had genuinely independent inspections. All of this is now public. You can go to the website of the Bangladesh Accord and see all of the inspection reports, what they found there in terms of problems with electrical, fire, building structure, what the corrective action plans are, what the timelines are. And I think this is sort of a model of how a new global supply chain protocol could work. There's also the Bangladesh Alliance, which is sort of the competitor to that is set up by Walmart in the United States, and the Gap, which is sort of a standard CSR voluntary program, which I think has not resulted in very much. The Bangladesh government itself is working with the ILO in a very large program to about triple the size of the labor inspectorate there, to give them training so they'd be able to do their assigned tasks. But again, it's a very poor country that's totally dependent on garments. It's 80% of the exports of Bangladesh are in garments. It's a government that cannot afford to lose garment manufacturing by, as in the case of Mexico, by having regulations that are actually enforced. But in the Rana Plaza moment that we have now, there's a lot of good work being done, and hopefully the government itself will have more resources at the end of the 5-year period of the Bangladesh Accord, for example, which ends in June of 2018. And then another question from Bob Harris. Do you think it would be possible to use the CSR as a quality mark where it is audited and examined in detail rather than just a policy to have on the shelf but then not mean much? Well, the whole question of certification or kite marks is also a kind of a controversial one in the global supply chains. Personally, I'm opposed to it because I think, like the CSR monitoring itself, these certifications have been completely gamed at this point. For example, 2 of the 5 factories that were in Rana Plaza had just shortly before the building collapse had been given certifications by the Business Social Compliance Initiative in Europe. The BSCI is a European monitoring and certification. So clearly, this certification didn't mean much in a factory that would collapse and kill everybody inside of it. Likewise, probably the largest, I think the largest industrial fire in the garment industry in the history of the industry itself took place in 2012 in Karachi, Pakistan, the Ali Enterprise factory, where literally 25% of the workforce, or almost 300 workers, were killed in a factory fire because of locked doors and all the things we've known about since the 1911 Triangle Shirtwaist Fire in New York City. But this Ali Enterprise, just 3 weeks before this fire, which killed 25% of the workforce, was given a certification under the SA 8000 program. So that, again, a death trap, obvious death trap to anybody who had been there, was given a certification in Bangladesh and in and in Pakistan. And just to use a third example, Apple has a supply chain that's centered mostly in China, and the New York Times did a big expose in January of 2012 about very unsafe and unhealthy conditions in the Foxconn factories that were producing for Apple in China. So Apple right away joined the Fair Labor Association in the United States and had the FLA do audits of 3 of their factories, and they found, I think fairly shockingly for us professionals, that in 2 of these factories that had no health and safety program to speak of, both of them had been certified under the OSH AS 18001 program. So these 2 factories, which had no literally no health and safety program, had essentially bought an 18001 certification, and I'm sure they're not the only factories in China where that's the case. So I think certification is a problem. It's very problematic the way it's done now, and I think it's much more important to have effective health and safety programs on a factory level, which include meaningful and genuine worker participation. That's it. Okay, well, as I mentioned, IOSH will be sending out, hopefully, to everybody on the webinar, these 3 documents related to the webinar today. One is a resource list. The second is a cheat sheet on how to improve working conditions and supply chains. And then the third is more information about those 2 cases of good practice, one in China and one in the Dominican Republic. And thanks again to IOSH for the opportunity to speak today. And if there's any questions that you would like to follow up with me, I believe my email address is on the screen, and please feel free to communicate with me. Thank you.